So welcome to ADAPT NCLEX, and thank you for deciding to watch this video. This video is designed to show you, teach you how to recognize buzzwords. I've been hearing that the NCLEX, the new generation, they're giving you long cases just to frustrate you and make you tired of reading. When you do that, then you lose focus of the most important information. So in order to recognize cues in the question, is to know what are the buzzwords so that you can ignore the noise. There's noise in every question, but ignore the noise and pay attention to the buzzwords. So this is what this case is going to be designed for. Things you already know, but just to show you that. Once again, you can join us in our review sections on Saturdays. This is a case that you already know, and then we'll go through it and we'll see how we can recognize buzzwords. This is the scenario. A client is in emergency room. A 70-year-old female presents to the emergency room with complaint of chest tightness that is squeezing and constricting in nature while eating dinner. The pain is retrosternal and it does not get better with leaning forward. She described the pain level as 7 out of 10 and worse with exertion. She also reported of shortness of breath with the pain. She feels that the pain radiates to the scapula. She's had this pain before and usually takes time for the pain, but this one is taking a long time to resolve. So she came into the emergency room. She feels like the room is spinning when she gets up. She feels like the room is hot, making her sweat. She has a history of anxiety that she takes Prozalan for it. She looked anxious but attributed to her anxiety. She smokes 2 packs per day, but reports no tobacco for 3 days. She recently separated from the husband and has been working nonstop to keep the family going. You see, did you recognize some cues? Did you recognize which one is the buzzwords? So, what are your buzzwords? What are your buzzwords? The case scenario, the location is very important. Sometimes age. So I'll separate age. 70-year-old female is a buzzword. Number one. Present to the emergency room. That tell you it's an emergency situation. So that will help you with the management. There's certain things you can do in emergency room that you cannot do in clinic. So number two, what is the chief complaint? With complaints of what? Chest tightness. Number three. That is, they describing the character of the pain. Every time they describe the pain or the nature of the pain, they'll give you more character. It's squeezing. It's not just chest pain, but this pain is squeezing and constricting. Another buzzword, number 4 and 5. In nature, while eating dinner, this is a distractor. Forget about it. I'll put a D there. The pain is retrosternal location, buzzwords. This is number 6. And it does not get better while leaning forward. This is good. It's a buzzword, but it's not a true buzzword to make you make diagnosis. This is to let you rule out other problem. Pain does not get better when she lean forward. So this help you rule out something. So this is the review of system. I'll put review of system. She described the pain level at 7 out of 10. This is intense, but it's not the true best way. It doesn't tell you which way you want to go. And worse with exertion. So you have exertional chest pain. And that is our number 7. She also reported of shortness of breath, associated symptoms. Not every chest pain is associated with shortness of breath. So this is number 8. With the pain, the client feels that the pain radiates. It goes somewhere. It doesn't stay in retrosternal. That's number 9. She has had this pain before and usually take times for the pain, but this does not. This one is taking a long time to resolve. I was trying to distract you here. So distract you, but at the same time, this is a review of system. Distractor, long distractor, embedded with the review of system. But this is taking a long time to resolve. So she came into the emergency room This should redirect you back to the main idea. I'm staying focused. This try to distract me, but I'm staying focused. Oh, then if this is not taking a long time, is it related to the one she used to take times? This has presented to the emergency room. She feels like the room is spinning. That's where it's number 10. This is what? Dizziness when she gets up. So she's getting into static because she's dizzy. She feels like the room is hot, making her sweat. Okay, she's diaphoretic, number 11. She has history of anxiety that she take approximate. This is a distractor. She looks anxious. This anxiety is not related to anxiety. Okay, this being anxious here is nothing to do with anxiety. So, but it's a distractor. So this is another buzzword. But with the, if you think that because she's anxious, that whatever she's saying, you should ignore it. Uh, she's anxious, but it's not related to the anxiety. So this is number 11. Even though she says she attributed to anxiety. She smoked 2 packs per day, but reported no tobacco for 3 days. You would think that she's withdrawing from the tobacco, nicotine. That's why she's anxious. This is a distractor. She recently separated from the husband and has been taking has been working nonstop to keep the family going. Another distractor. So you see, so we have distractor here, couple of distractor, and review of system. What is your diagnosis and what are your buzzwords? Those have underlined. And those have underlined are things when it said which of these need additional intervention. You need to intervene in those to help you make the diagnosis. I'm worrying about the squeezing, constricting nature, rectosternum. He has 7 out of 10. He radiates to the scapula, associated with the shortness of breath. It's a pain that is worse with exertion. It's making the room spin. I'm diaphoretic and I'm anxious. That is what we're having a myocardial infection. Buzzwords, 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 people. You got to be able to recognize cues, right? Number 1 question. Similar one. This one you know. A client in the peds clinic. Okay, this is important. This is 12-year-old female present to the peds clinic for recent bedwetting, buzzwords, and being weak, buzzwords. Fatigue. She's always drinking water, right? Polyphagia, basically drinking. Okay, she is having has to drink for a long time, always drinking and drinking and eating, polyphagia, but kept on losing water and weight. So she has polydipsia, that has to drink all the time, and polyphagia, has to eat all the time, but still losing weight. It feels like she cannot hold a urine for a long time. What is that? Making a trip to the bathroom and peeing all the time. Polyuria. It's like basically peeing too much. She wants to stop drinking, but she can't help it. That's your clue. Upon questioning, the mother reports 3 days of what? Diarrhea. After visiting a friend's house where she had chicken soup. This is another buzzword. I'm hiding it. This is sick. It's a sick day, okay? Yesterday, the mother noticed that the client started smelling like what? Fresh fruits and other buzzwords on the counter. Client appeared with fatigue, buzzwords, pale, buzzword, skin and mucous memory, dry, buzzwords, and taking deep, rapid breathing, buzzwords. Tachycardia, blood pressure on the low side, and dyspnea. Exams, excellent. What are your buzzwords? I'm weak, I'm 15-year-old. Now I'm bedwetting. Why am I bedwetting? You past that age. Even though you're drinking too much water, it has nothing to do with that. I'm eating all the time, but I'm losing weight. I cannot hold my urine for a long time because I got to pee multiple times, multiple trips to the bathroom. Recently, I got sick. I'm having diarrhea. All of a sudden, I'm smelling like a fruit. I appear fatigued, pale, my skin and dry mucous memory. And I'm taking deep, rapid breathing, hypotensive, and what? Tachycardia. What are your buzzwords? Those I've summarized to you. What do you think this patient has? Undiagnosed diabetes. Okay, insipidus, right? No, diabetes mellitus. It's not insipidus just because it's peeing all the time, just because his mucous memory is dry, just because he's pale and weak, just because he's hypotensive, just because he's making trip to the bathroom. It can be insipidus. It's mellitus. Why? I have ketones. I smell like fruity. I smell fresh fruits. That is your buzzwords. Don't pick diabetes insipidus. It's mellitus. And those are the things you should recognize. You should be doing when you take these exams. Review of system in your head by paying attention to key words in the sentence and rule out and rule in. These are your buzzwords. Take care of yourself. And if you need more content like this, check ADAPT NCLEX. And then subscribe so that I can send you notice on all those new lectures I will make relating to these buzzwords. I'll be making a couple of buzzwords questions that you should pay attention to that. Anyway, take care. All the best of luck and good luck.